Well, Dr. Reynolds, thank you for that opening statement to the to the 91st session of the Flint
Thanks.
community webinar on coronavirus. And it is just so exciting for all of us to be here today. This webinar, for those of you who are just joining us, welcome. This webinar is sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. If you joined us just before Dr. Reynolds' magnificent statement, you recognize that there's conversation that goes on a little bit before the webinar. So you're welcome to come in about 5 minutes early and get ready for it. I thankfully appreciate the opportunity to be your moderator for today for these weeks as the co-director of the Healthy Flint Research Coordinating Center. We have amassed a number of partners over these last 91 weeks that have been here to answer questions for you, to provide relevant and credible right now information, not only regarding the coronavirus, which was our initial focus, but also about other really important issues that arise in our community because, as I say so often, we are whole people. And a lot of things affect us every day. And so we appreciate the partners that have joined us. Today, we want to give a special shout out to our partners as we look at addressing other issues. Today, we're going to be talking about facing school trauma. We'll be talking about alcohol and substances and the holidays. This is a question that's come up for us. We'll have a magnificent medical moment for you. And then we'll have our regular updates from the Genesee County Health Department, the city of Flint. Today, we want to take a moment to highlight our hospital and healthcare partners that have joined us, Hurley Medical Center. We had Dr. And I just chatted with him the other day. We had Dr. Michael Tupper, who joined us early in the pandemic and told us how wonderfully well the hospitals were out and about doing actual beginning that COVID testing. Hamilton Community Health Network has been a partner with us. McLaren Flint and Ascension Genesis have all provided wonderful information for us. So I'm going to ask our partners to come be a part of this conversation. Clarence Pierce, Dr. Deborah Verholden, Dr. Wolford, Dr. Lawrence Reynolds. We're going to have just a really quick roundtable today as a spinoff from our earlier conversation. We were talking about the virus. Dr. Deborah just brought in a new term for us. Again, it's not a new term, but a term that's been used about the COVID or SARS-CoV-2 being a novel virus, and then the multiple mutations. So we just want to dive into that a little bit for our panel because we've gotten so many questions about these different variants and why we talk about them, why they're named. And so I just want you to jump right in and continue that conversation. Starting with you, Dr. Deborah, tell us again, novel virus, SARS-CoV-2.
Yeah, so coronavirus, the family of coronaviruses, where the common cold falls, that in fact is not new to the human
population. Common cold?
The common cold is a coronavirus. The common cold is a coronavirus. So coronaviruses are not new. Yep.
Okay. So what makes this one so different?
Well, so if you go back to our early conversations, corona means crown. And that's because if you look at it under a microscope, it's a round molecule with these little spikes coming off of it, these spike proteins, and it kind of looks like a crown if you're looking at it in one dimension, right? And so what makes this one unique is it's got its own footprint. It's got its own profile, and we named it. We got the genetic sequence for this particular coronavirus, and it was named SARS-CoV-2, SARS coronavirus 2. That is the name of it. And then once it spread into the human population and we figured out, we believe it originated in bats. And it's really funny because there are things and viruses that live in humans that would be harmful to animals. There's also viruses that animals can carry that are fine with them, but are very harmful to humans. So SARS-CoV-2 is a novel virus in the human population. It is new to us. And that's what we mean by a novel virus.
And yet you're saying that some of there's some similarities. And Dr. Reynolds, you were talking a little bit about the similarities, and you just told us something that was amazing. So share that again.
Well, we talk about mutations. Perhaps one mutation doesn't mean a whole lot. In some conditions, it's significant. But in these viruses, there's up to 30 mutations that have altered how this virus lines up the spike protein lines up with the receptor on our cells, and that is significant. Okay, so these variants, these mutations can result in a variant that has clinical significance or concern. And that's what we're dealing with now. And let me just diverge, because you said there are people who say, I don't trust that vaccine. Well, I don't trust the virus. Okay. I don't trust
Okay.
it to do the same thing every week that it did the week before. And that's why we do this genomic surveillance. We don't do it, the labs do it. And you don't get an instant answer because it may take 1 or 2 weeks just to find out what the mutations are and what the variant is. Then it may take another 2 weeks to see how it affects disease or transmission or contagiousness. So all these things take time. And I've said before, this novel virus, this new virus is very humbling because we don't have experience. We have educated guesses. We have tools that we use on clinical level, research level to find out what's going on. But we have to be on our toes, which comes back to use the tools you have. Get vaccinated. If you have problems, get tested, wear a mask, wash your hands, physical distancing, and get good information, because misinformation is the biggest enemy.
Thank you, Dr. Reynolds. I want to jump back over here to Dr. Deborah. We were doing the alphabet, Greek alphabet earlier, and then I'm gonna segue into Dr. Wolford. But that Greek alphabet, so there are a number, like you said, there's a variety of these viruses, but why are they named? And tell us how far is it from the Delta in the Greek alphabet to this Omicron?
So I'll give you all the way through to Omicron. So we name the particular variants that they call of concern. So if it looks like a particular variant causes more harm, more illness, might somehow elude the vaccines or things like that, we'll call it a variant of concern. It'll get a name. In the same way we name hurricanes alphabetically, the first one will be Apple, the second one will be Betty, the third one will be Charles. We name the variants with Greek letters. So Omicron is 15. We went Alpha, Beta, Gamma, Delta, Epsilon, Zeta, Eta, Theta, Iota, Kappa, Lambda, Mu, Nu, Xi, Omicron. And we are now on Omicron. And for all my people who are on Twitter, it is not Omarion, it is Omicron. It's a Greek letter, Omicron. So it is the 15th one of note. Notice, anybody remember anything about the Mu or the Nu or the Iota or so there have been other variants that we thought, or have risen to the level of concern, but they turned out to not be ones that, seem to produce any, things that we really needed to be overly concerned about.
So thank you, Dr. Deborah. We're going to ask folks to stay tuned. We have so much to share with you today. We've got some things coming up. Before I get to Dr. Wolford, save some of your comments for your medical moment. But I do want to say, Dr. Clarence Pierce, who is on the line with us as one of our highlighted partners today in addressing these issues. One of the partners, Hamilton Community Health Network, is here to help to address some of those issues. Dr. Reynolds said, do those things, wash your hands, so forth. But here is a medical opportunity, a service opportunity for you. Clarence, can you give us just a minute or so update of what's happening at Hamilton?
Yes, Yvonne, thank you so much. We are vaccinating as many people as we can. We are doing events, and I want certainly your listeners to know that you can go to any of our health centers and get vaccinated. We have all 3 of the vaccines available, and we're focusing on the children these days, trying to get as many vaccinated as possible. And we're doing events. We had an event at Grace Temple just recently. We also had an event at our health center over at Maine, and we're doing all the vaccinations that we possibly can. Now, you can also make an appointment if you want to make an appointment, so you have a specific time to come in, we have appointments available. But I would encourage all your listeners to get vaccinated. Any defense that you can put together for yourself and people around you, please take advantage of it. We're doing the vaccinations. We're not charging anything. It's free. Come on in, get vaccinated, and we will take care of the charges.
Thank you, Clarence. And it's so important to have our own folks right here in the community to say we're here ready to help. Now, you touched on something that's really near and dear to our next speaker's heart. So I want to thank Dr. Deborah, Dr. Reynolds, and Clarence. But Dr. Wolford, we did a quick roundtable because we've got so much on the program today. But he talked about children, and one of the things that was said is it seems like this Omicron is affecting children more readily. But I want you to just come and just share with us your medical insights for today, Dr. Wolford.
Thank you so much, Yvonne. So today I want to talk about a question that affects both adults and children. And the question I've been hearing recently, or the statement I've been hearing recently, is that people who've been vaccinated are infecting those of us who are not vaccinated. And I was surprised when I heard that the first time, but I've been hearing it more regularly. So I want us to look at the science and understand why that just cannot and is not the story that should be told. Okay? So if you want to spotlight me, for all those so they can see what's in my hand, I want us to consider being infected by COVID as having this red fluid inside us, okay? Each one of these bottles is a person, and having the red fluid inside us means that that person has COVID. There's a number I want you to remember, and the number is that 10 times more likely for somebody to have COVID who's unvaccinated than the vaccinated person here with the ribbon around there to indicate that they are vaccinated. 10 times more likely to get infected with COVID if you are not vaccinated compared to if you are vaccinated. Now, if that is the case, you can't spread something that you don't have, right? So you are 10 times more likely to get COVID from somebody who is not vaccinated versus somebody who is vaccinated. Notice my spice stand. I don't really cook using the spices, so I thought I may as well use it for the demonstration. Now, that's the first reason why it's not true to say to be all concerned about getting coronavirus from somebody who's vaccinated versus not vaccinated, right? The second reason is, yes, while it is true that this one person who is vaccinated, while they are contagious, can spread it, and therefore we should wear our masks, etc. That's just like these 10 people, well, more of them are spreading it because more of them have it, right? Then some studies suggest that even though this person, one person, as opposed to the 10 people over there, may have gotten coronavirus and may be able to spread it, or would be able to spread it, their viral load, the amount of virus they have in them is less than the ones who are unvaccinated. Now, that was definitely true when we were dealing with the initial variants. That might not be as true with the new variants. But one part that is true, when you are vaccinated, you are able, unlike those who are unvaccinated, who have to make these antibodies having not had a chance to train, but you are trained, your body's trained. So it very rapidly gets those antibodies in, and being vaccinated means that you are able to clear that infection much, much sooner than you would be if you did not have the vaccine. That red COVID is going away much faster. So there are fewer days when you could be spreading the vaccine, spreading the virus if you were unvaccinated. So that's the message. If anybody says to you that vaccinated people are putting everybody else at risk, this is not the case. 10 times more likely to get it if you are unvaccinated than if you are vaccinated, and you clear it faster if you are vaccinated, so you have fewer days when you're spreading.
Wow. Thank you, Dr. Wolford, for that example. I hope that this will help some of us to know the value of getting the vaccine, but also just to be able to clearly explain what's going on. I got to find another use for my spice rack. So thank you so much. When we talk about issues that face our community, one of the things we know is that there are more than one thing that we have to deal with at a time. On top of coronavirus, we have other traumas that face us. And we're happy to have our partner, the Genesee Health System, to help us deal with this. A couple of weeks ago, we had a tragic incident in our state, just a little ways down the road, and then even some concerns about our local community. So Katie Baxter, who is the Senior Director of Clinical Services at the Genesee Health Systems, is going to give us some insights on how to deal with school trauma. How do we help our children in the face of all of these traumas they're dealing with? Thank you, Katie, please.
Thank you so much, Yvonne. I appreciate you having me and inviting me to talk about this important concept. When we heard about the Oxford shooting, so many of us were just shocked and really horrified and had all kinds of feelings. So this is just an opportunity to talk for a few minutes about what trauma is, how it impacts us, normal responses to trauma, and how our brain responds to trauma, and what we can do to take care of ourselves and our community. The National Child Traumatic Stress Network says trauma occurs when a child experiences an intense event that threatens or causes harm to his or her emotional or physical well-being. Okay, and more than 2/3 of kids reported at least one traumatic event by age 16. And about 20% experienced 3 or more. So trauma is relatively prevalent, unfortunately. Trauma takes many forms, and these are some of the main ones: physical, sexual, and emotional abuse or neglect, domestic violence in the home, and community-based violence like the school shooting in Oxford, extreme poverty, loss of parent, or primary caregiver, and this could be through death or even incarceration, natural disasters, and extreme bullying. SAMHSA says there are 3 E's of trauma to keep in mind. It depends on the event. It's an event or series of events that occur, and it has to be experienced as harmful or life-threatening, and it has lasting effects. But the thing about lasting effects is it depends on how severe the trauma was, what was the event that occurred, and how much it impacted us. So if someone had a house fire and they came home and everything was burned up and they had lost things and they had to be displaced from their home, that's traumatic. But if somebody lost somebody, a loved one in that fire, how much more traumatic that is. And so it also, lasting effects has to do with our own coping skills and our resiliency. So we'll talk a little bit more about that too. These are common reactions. Sometimes when a traumatic event happens, people say, I don't know what's wrong with me, this isn't like me, and why is somebody behaving a certain way? Keep in mind that there are normal common reactions to trauma. And when people have the support they need, things will ease and they will get better. These are some of the common reactions. Fear and anxiety. It's often common for individuals not to want to go into public settings if something bad happened in a public setting. They have changes in their behavior that can mimic depression, like a lot of emotions, decreased concentration, sadness, crying spells. Their sleep and their appetite can be impacted. They might engage in harmful habits like substance abuse or even cutting, and a lack of interest in usual activities that they like to participate in. Often people have physical complaints, headaches, stomach aches, things like this. They might be hyper-focused on the shooting or the traumatic event that they experienced, watching it again, watching videos about what happened, talking about it constantly, having dreams. And they may have strong reactions to reminders of that traumatic event. And it's also normal for people to have increased sensitivity to sound. If a chair falls over or somebody screams or they hear a loud bang or firecrackers or noise outside, they may have a real overreaction to that because it's a reminder of the trauma that they experienced. Trauma and the brain. Trauma is very difficult on the human brain, and chronic exposure can damage children's brains. It activates the limbic system in our brain. The limbic system is kind of our midbrain there, not the executive functioning of the frontal cortex here, but the midbrain. And it creates a lot of stress hormones in our body. These stress hormones are normal for fight and flight. If something bad happens quickly, I can move and get out of the way. If I'm walking down the sidewalk and a car comes way too close or comes up on the edge of the sidewalk, my body tells me how to react and jump right out of the way kind of thing. That's what we need to do to react quickly. But if I have this chronic stress hormones in my body, it's not good for my body or my brain. And what it does is it pushes our prefrontal cortex or learning part offline and brings that midbrain up into the forefront. What we know is that the hippocampus is the brain's deepest memory. It remembers everything that happens, the good things and the bad things, because it wants to be able to protect us and say, oh, I know that. I know what trauma is. I've experienced that. What this can do is causes us to overreact to minor stressors. So sometimes you might think, why is somebody behaving that way? It wasn't that big of a deal, or what's going on? And many times that's because the situation that occurred triggered a past trauma. So it might not have been so much about what's happening now, but that triggered some trauma they had in the past, and that's why they're responding in those kinds of ways. But I want to say that a hopeful message that children's brains are malleable and they can heal, and children are resilient and people are resilient, and there's lots of things we can do to help each other and to help our children heal. These are some of the things we can do. One of the most important things we do is reaffirm safety. Children need to know they are safe. We can talk to them about that, reassure them that they're safe, and tell them ways that they are safe. Please take time to listen to people when they've experienced trauma, particularly children. Everyone processes it differently. Some want to talk a lot about it, and some don't feel comfortable talking very much at all. But it's important that we create a space for them to talk and allow them to process that. Because one of the things we know about trauma is we do need to process it and make sense of that. It's part of the healing process. Please keep conversations developmentally appropriate. What we talk about with teens is not the same as what we talk about with little ones. I ask that people really think about shielding little kids from too much content. Often parents don't realize, or educators or just people don't understand how those little brains can't deal with all that stuff. So we see something on the news and we're watching it. It's on our phone or it's on the TV. And so we're watching it or listening to it and thinking, oh, they're doing something else. They're not hearing it. They are hearing it. And it's very hard for them to take in because they don't know how to process it. And they can't discern from, is that something that's going to happen in my house right now or when I go to sleep, or that's something that happens somewhere else. So it's very important that we protect our children. So limit that exposure. And that can apply to us too. Too much of that is not good for us either. Spend time with people who've experienced trauma. We think about our children. Our best present for our children and our grandchildren and other children we love is our presence. It's so important that we spend time with them. We're there to support them, help them talk about things. We know what's going on. We think about teens. People don't realize that teens need a lot of supervision too. They're independent, but they need adults there to help them make good decisions. Also, I think it's so important that we keep a routine when we wake up in the morning, when we go to sleep, having meals and regular things that we do that are routine. And that helps our brain go back to a kind of a homeostasis and not chaos and change. Also, take care of yourself and take care of our children. Just like our doctor tells us that all of these things about our health, how important that we get good sleep, that we look at our nutrition and the kinds of things we're eating, and that we're getting exercise. Get out and get some fresh air, take a brisk walk, or make a snowman as when we get snow. Things like that to get moderate exercise. When you're doing these kinds of things to take care of yourself, you're in a better place when difficulties arise. It's very important. Please give yourself a break and give yourself some grace. You're not always going to say the right thing, and you're not always going to do the right thing. We are humans. We do make mistakes, but the intention is that we care about others and we're doing what we can to help and support them. Be patient with yourself and be patient with children. One thing we know about trauma is that children don't learn very well when they're traumatized. Because remember, when we talk about that brain up here, the frontal brain, that's all your executive functioning that helps you make good decisions and think things through. When we have a lot of anxiety and stress, this isn't activated. It's more of our midbrain that's being activated. So sometimes it takes a longer time for children to do their chores or do homework, and they might seem distracted or not have concentration. So keep that in mind. Those are some of the things that people experience. And monitor children's behaviors and how they're doing, and look for risky signs that a child does need help. And please seek help when kids need it or when we need it. There's nothing wrong with getting mental health help. It's just like we would get physical health. It's so important that our mental health, we keep this in mind, our mental health is part of our overall health. So please seek help when you need it. And I just want to talk about trauma-informed communities. We're all part of communities, and it's so important that we each play a role in having trauma-informed families and neighborhoods and communities and all of this, and we all play a role in that. Some of the things that are important are good prevention programs so that we have good, strong family, healthy family units. That's so important. When we have strong family units, we have strong neighborhoods and strong communities. And so we need those strong paternal and maternal bonds from the time children are little and as they grow up, and having good prevention and education programs and resources so that families can have those things. We also, neighborhood grassroots organizations and community leadership opportunities. So these are so important, just like this webinar that's come for 91 weeks and shared all of this information to educate us and give us information so we can make good decisions and we can be healthy and we can be resilient. And our faith-based resources, what would we do without our faith-based community? Also, evidence-based treatment, how important that is. It's very important that we have treatment that is based on the research that shows us this works. Also, access to care for everyone, even people who are the most vulnerable. It's so important. And that we have collaborative public and private systems coming together, whether we're part of healthcare or law enforcement or the county or we're parents, we're community members. We all play a role in this. And supportive legislation, how important that is that we have appropriate funding and necessary funding and legislation that keeps us safe and healthy. So these are some of the kinds of things that we can all think about and work on, and everybody do a little piece of that. I want to remind you of the resources that are available. We have more mental health resources available than we ever had, and it's good because we need them now. We've always had a 24-hour crisis hotline, and that's not going to change. That's the same number that I've talked about before, 257-3740. We also still have our text line, text Flint to 741-741. That's a good resource for teens. Make sure our teens have this available and they know it's okay to reach out. And now we have our BHUC. That is our Behavioral Health Urgent Care. We have a walk-in place where you can go walk in. It's across the street from our main campus, and it's open 8 a.m. to 10:30 p.m. from Monday through Friday. It's our soft opening. We opened on October 4th, and we will eventually have a 24-hour crisis center. But right now we have that soft opening. We also have the BHU, our virtual 24/7, 365 days of the year there's access to virtual telehealth, and you could talk with a counselor and have a session right over the phone and not even have to leave your home. So there's lots of resources available. Please avail them to yourself, and thank you so much for listening. Make sure to distribute on our urgent care and the resources we have for mental health supports. Thank you so much.
Thank you so much, Katie. And we're going to ask our listeners, if you have questions, please feel free to put your questions in the Q&A so we'll be able to answer them for you. And as we talk about these crisis situations, we also understand we're getting into the holiday season. And one of the things that was asked, how do we prepare for the holiday season? It's a tough time for a lot of people. And so we want to just ask Carrie Chanter, who is also from Genesee Health System, to give us some insights on preparation for the holidays. Thank you, Katie. And now, Carrie.
Thanks, Yvonne. I'm so excited that you've asked me to be here to talk about this really important topic. You guys, we're in holiday season. I don't know about you, but I cannot believe it. It's past Halloween. So these next 3 weeks are going to go by pretty fast. So all these holiday gatherings and things are starting to happen, starting to occur. It's really important to remember that this can be a really tough time for many, and which can lead to increased substance use and death as a result of. So we know that depression, anxiety, and stress are all heightened around the holidays. So it's here, it's upon us. And we know that the most dangerous times of the year for drug and alcohol related deaths are specifically December, but also December, January, and March. So since 1999, so the last 22 years, we've had nearly 91,000 deaths that have been reported in 1 month in our nation in the month of December related to alcohol and drug related effects. So we know that drug overdoses also occur during the holidays. So we need to be on the watch out for that. And there's lots of reasons why this happens. I want to remind everybody that about a quarter of Americans report having higher levels of depression during the holidays. And we're going to talk about why. And about a third of Americans also drink more during the holidays. So that's a little alarming. So next slide, please. What are the next 2 slides I want to talk about? Why do we see this increased use of substances? Well, there's a lot of triggers for people. Stress. We know that worrying about buying the perfect gift, going to all the parties, decorating, financial strain. This is a horribly financial straining time for most people. And also strained family relationships, traveling, getting to the airport, just getting all these things done. It just seems like there's always something to be done every moment. So that's that holiday stress I'm talking about. Well, let's couple that with the isolation that they've been in their home through the pandemic, avoiding celebrations intentionally. So on top of that, people are dealing with some isolation feelings. And then while holidays can be so celebratory for many, it is a time of holiday grieving for many people. And we need to remember that. These time of year can be very painful for people, for good or bad memories that they may have, or the fact that they can't see family that might be on the other side of the nation, or the fact that they've lost someone in their family that they wish were here still. And there's a lot of sadness and loneliness that can go along with that. So next slide. The last 2 things I wanted to mention is that during the holidays, sometimes we don't have a lot of our natural supports that we might have. I mean, it's kind of like the feeling like a temptation, like when you're with other people, they're like, oh, just have one. Or, if we're talking about using drugs, just, it's the holidays, just, go ahead and do it. It's almost like a feeling of encouragement sometimes. So that lack of support tends to fade sometimes during the holidays. And let's not forget seasonal affective disorder. This is a real thing. The shorter days that we have with less sunlight can intensify feelings of depression and bring on seasonal affective disorder. Sometimes people call it the winter blues, but it can be much, much more than just the blues for many. So how can we remind ourselves to navigate these holidays? First, it's important to remember that people that are in recovery, these tips are for people that are in recovery, but also for all of us that may not struggle with addiction, but we know that we may have increased use during this time. And it's important to do these following things. Just as Katie said, practicing self-care is so important during this time, and making sure that we're getting enough exercise, enough sleep, enough downtime. That can be really hard. Sometimes people find relief with doing mindfulness practices. There's a ton of YouTube resources that are legitimate and good for doing different meditation practices that can be anywhere from 3 minutes up to 20 minutes. So real easy and free resources are out there to do mindfulness practices. Try to limit the triggers that you know are in place. Try to limit those things that we just talked about in the last couple of slides. You don't have to go to every party. You can absolutely say no. I have too much on my plate. And sometimes we have a hard time doing that. Making sure you're setting boundaries, say, yep, no sleepovers, no additional kid activities during this time. We have too much going on. I'm only going to go to one party this day because I have too much, our family has too much on our plate. If your goal is to not drink or use substances, you really need to rehearse how that's going to go, and how you're going to decline and say, nope, not today. I'm not feeling it. Or maybe next time. Just rehearsing how that conversation is going to go will help many people to try to avoid things that are not healthy. Also, if you are a person in long-term recovery, be prepared for questions. If you do go to an event, people may ask you about how your recovery is going. So those are things that are helpful to have a plan in place before you go to an event and kind of practice that conversation in your head. I already kind of mentioned this, being intentional about the invitations that you accept, knowing which ones mean the most to you, and maybe just avoiding the ones that aren't as important. The last few things are, again, I talked about this a little bit, creating a plan. What is my plan? What are the events that I absolutely have to go to? What is my budget this year? Sticking to your budget. That is a plan. Making sure, like, if you certain things are important to you to get in the holidays, say, yep, this is one of my priorities, and these are the things that we're going to do. Pick a new healthy activity that might use some of that spare time on those parties that you don't really think you should go to. Picking up a new healthy activity, maybe it's outdoor walking or finding a friend that is supportive for you. Seeking a support system, maybe calling a college friend you haven't talked to in a long time, or a family member. That can be very therapeutic for many. Connecting with sober and supportive contacts. A lot of people who are in long-term recovery will go to a lot more meetings during the holiday times, and that seems to help many. And again, practicing mindfulness and other meditations can be helpful. So let's say you are going to host a party, and there is going to be alcohol there. There are some important things that you do need to remember as a host. It can be really helpful to many that are coming to your party that have anxiety about coming and maybe drinking too much or not wanting to drink. Make sure that you're offering a variety of non-alcoholic drinks, water, juices, sparkling sodas. There's a lot of non-alcoholic fun drinks that are out there, a lot of recipes. Making sure you're providing a variety of healthy food and snacks. We know that food can actually slow the absorption of alcohol in the body by 1/3. So if you can have some good food there, that will help your guests. And the responsibility is on you to make sure and help your guests to get home safely using designated drivers or taxis. And the last thing that's really important, there are lots of social hosting laws out there that people are not even aware of. If you are providing alcohol to somebody that is underage in the home, it is illegal, even if it's your own child. And so people are sometimes not aware of those. So if you're a parent, make sure you understand those underage drinking laws and set a good example, because they are watching. I want to remind everybody that either is struggling with substance use or has a family member or a friend that's struggling with substance use. Don't forget about the GHS Access Center. That number there is right there. Please call the 810-257-3740 number. They will do an assessment with you about your use and determine if it is indeed a substance use disorder and at what level that is, and then offer some entryways into a different variety of treatments depending on how severe your substance use disorder is. Next slide. If there's any questions at all, please feel free to reach out to me. Happy to connect you with any kind of resources that you need. Thank you.
Thank you so much, Carrie. Now I'm going to ask you and Katie to just share with me just for another minute or so. There's a question in the queue that I think is really important. First and foremost, we're doing this particular segment today to give us time to get that plan in place and to help us to understand we're not alone. But there is a question. How do we help our older generation? So obviously this comes from a young person. Our older relatives understand we really do love them, but we cannot take the risk of exposing them or newborns or themselves. And I'll just get to the last part because they have grandparents that they're concerned about. And sometimes they say, what is your, they're feeling as if that when they share this information, and speaking to the older generation, it sounds like they are condescending when they're really not trying to be. What advice would you give to them?
What I would say is, and Carrie may have something to offer as well, but what I would say is that I think we share from our heart. You know, that just as in this, I see, and through that just type message, that there's a real concern and love there. So we share from our heart. And remember that not everyone's going to respect the decisions that we make to protect our families and things. People have different opinions and ideas, and that's okay. And we're different people. So to remember that and have some level of acceptance that people are going to see things a little differently. But we have to do what is right and good for ourselves. And I would communicate that with love.
I would absolutely agree with Katie, and I'm actually struggling with some of that with my own family. I think sometimes the older generation gets the vaccine, gets the booster, and they feel invincible. And I just don't want to be responsible for the one that's going to put them in the hospital. And that's exactly what Katie said, just speaking from your heart, making sure you're doing it with love. And at some point, you do have to accept that people may not agree with you at all. And that's okay, but you have to do what's best for your own family.
Thank you, Carrie and Katie, for those answers and for your transparency. I appreciate you coming on today. And there'll be more to come. So please continue to put your questions in the queue. When we talk about protecting our families and protecting ourselves, one of the ways we can do that is have good information and then know where we can access resources. And we're going to talk a little bit with Sherelle Brown now to help us to understand what's happening from the perspective of the health department's role in providing opportunities and access. Sherelle.
Good afternoon. So as you all know, we are still continuing our efforts to vaccinate individuals within the community. Right now, we're just under 375,000 COVID vaccines being administered throughout Genesee County. If you haven't gotten your vaccine yet, we are waiting for you. We have first doses, second doses, third doses, as well as booster doses. So we encourage you to come out to our clinics and get your vaccine. Next slide, please. Next slide. And with that being said, if you didn't know, there was a recent approval through the FDA for booster doses in ages 16 to 17. I do want to let you know that right now the health department isn't administering those until we have received official guidelines from the Advisory Committee on Immunization Practices, the Center for Disease Control, as well as MDHHS. So hang tight for booster doses for the 16 and 17-year-olds. They will be coming soon. And for more information, visit us at www.gchd.us. And there are a number of testing locations within the community that also provide vaccines as well. We have Word of Life, Bethel United Methodist Church, and Macedonia Baptist Church, which all provide the Pfizer vaccine and free COVID-19 testing. So please do get your testing done. It's getting close to the holidays. There will be more gatherings. So we want everyone to make sure that we're taking precaution and getting tested and getting our vaccine for protection. And you can also visit your local Rite Aid or Walgreens or the Hamilton Community Health Network for a test. And I would like to mention that I'm going to talk about upcoming clinics. I would like to mention that the Genesee County Health Department will not be implementing vaccine clinics from December 20th through January 3rd, but we will resume on January 4th with our vaccination clinics, but those testing sites that I named on that last slide, they will be available during the time that we are closed for testing as well as the Pfizer vaccine. So our upcoming clinics right now, we are at Lake Fenton High School. We'll be here until 5 p.m. We do have Moderna and Pfizer. Ages 5 and up can come and get a vaccine today through 5 p.m. And then next week, we'll have our 3 standing clinics, Tuesday at Our Lady of Guadalupe from 12 to 6 p.m., which is an extended clinic because we want to make sure that we get the round of people who went to Mount Morris High School and prior clinics, their second doses. So we'll be at Our Lady of Guadalupe until 6 on Tuesday, when usually it's about 2, and we'll have Moderna and Pfizer. And then Wednesday, Central Church of the Nazarene will deliver Pfizer, Moderna, and Johnson & Johnson from 10 to 12 p.m. And Thursday, we'll be at Shiloh Missionary Baptist Church, wrapping up our clinics into the new year, providing you with Moderna, Pfizer, as well as Johnson & Johnson, and we'll be there from 3 to 6 p.m. So I urge you to get your vaccine before the holidays so that you can feel confident knowing that you are protected. And for those who are homebound, you can give us a call at the health department. We do have staff that will come to the home to administer the vaccine. You can reach us at 810-344-4800, or you can visit us at www.gchd.us/vaccine scheduler/ for more information or to get signed up for homebound visits. Thank you.
Thank you so much, Sherelle, and appreciate that clarification about the holiday week. So if, again, you can't get to those other events today from 3:30 to 5:30 at the Genesee Health Plan, there is an event for both flu and COVID vaccination. So be wise and let's immunize. Dr. Deborah, we're at some really important critical junctures in our community. With related to some data. Can you give us an update? I'm a little bit concerned about what you're going to tell me, but I need to hear it.
Yeah, so we mentioned last week, I was on with my colleague, Mary Catherine Crawford. I want to just shout her out. She, this is her baby, and the baby's birthday was last Saturday, and we didn't celebrate that. So I just want to give her and a shout out. The COVID health, the Flint, Genesee County COVID health equity brief turned a year old on December 4th, a year old. So it's been 1 year of doing this. Mary Catherine had this thing in her heart and soul and said, Doc, we got to do it. We got to help people make sense of policies that are coming out related to COVID and other things, health and racial equity and health equity and gender equity and just, all of that good stuff. And we need credible ways to get information to people besides the webinar. So the baby is a year old on last Saturday. So thank you, Mary Catherine, for your great leadership on getting this thing going and keeping it going week after week. So here's what we got with the data. And then you got the caution. And Mary Catherine said, Doc, you see the numbers have gone down, but take that with a grain of salt because it was Thanksgiving. What happened for Thanksgiving is a lot of the testing centers were not open. The day before, they closed early. They definitely weren't open on Thanksgiving. Some were open the day after. And so what we just had is fewer people got tested is what happened. So there was likely a lag in those cases being identified, not a lag in the data coming in, but people they weren't able to get tested. And so as you can see, we had that just little teeny dip last week, but followed by an increase this week. So my point is we're still on the rise. If you compare last week to this week, the numbers went up substantially in Genesee County from just under 1,500 to well over 2,000. And in Flint, we went from just under 300 to nearly 400 cases in the city of Flint. Testing positivity rate is still hovering at a really high point. 25.5% testing positivity is really high. You would not expect that 1 in 4 people getting a test would be COVID positive, but that's what that number says. That's what 25% is. It's 1 in 4. So we got a lot of COVID in our community. And now with this new variant, Omicron, and it's all preliminary, but it looks like Omicron is more contagious So if people don't really put those precautions and those prevention measures in place, we potentially run the risk with this new variant, depending on how strong it takes hold in the community, of seeing these rates continue to go up. So the numbers are still increasing. People got to really mask up, be mindful, avoid those large crowds, and wash your hands, people, wash your hands. All right, so we did a couple of other things this week, looking at geographic spread and also looking at hospitalizations among people who are vaccinated. This is kind of good news, right? Because the question that people keep asking is, will the vaccine continue to protect me from these new variants? And I've heard people say, well, why bother? If I'm going to still just be able to get COVID, why bother? Why bother is the vaccine is still very life-saving. And the vaccine does a great, great job at preventing severe illness and hospitalization and death. And I love this. Our team sort of said, let's see what the data say. And if you look from August to December, the percentage of people who've been hospitalized because of COVID and COVID-related complications, the percentage of people who are vaccinated, fully vaccinated, is continuing to go down. Now, don't get me wrong, we don't want anybody, this is a preventable, illness. We don't want anybody to get sick from COVID, but the data are clearly telling us the likelihood of you getting severely ill if you're vaccinated goes way, way down. And now we've got good data to say, even if you're vaccinated, you get that booster shot, and then your risk of complications goes down even further. So the data support that. So I just encourage everybody, get your vaccine and then get your booster dose. When we look at how it's spread in our community, it has the case rate. So the number of cases for the population in any municipality within Genesee County, that went up uniformly across the county, except in Clayton Township. And they were actually already pretty high in the month of October. So when we compare October and November, almost everywhere in Genesee County, the number of cases and therefore the case rate went up. Flint is still pretty low. We're about number 7 out of the 20 plus municipalities in Genesee County. But I just don't want to give people a false sense of security. Our real goal is to get those numbers down to as close to 0 as possible. And then just graphically displayed, you can see the deeper the color, the greater concentration of cases. And our goal is to almost see this whole thing start to go white. But instead, you can see the colors are getting darker. And that's just another way of showing people where, and also the fact that the actual case rates and the case counts are going up. It's going up in Flint, and it's going up all across Genesee County. Yeah, not the good news, but just the news. So yeah. Prevention. Get that vaccine, get those boosters, keep doing the things that we keep talking about to keep you and your family and your community safe.
Thanks, Dr. Deb. Now, Mary Catherine is going to close us out here with the policy update.
Yes, and I'm going to be quick so that we give Kiana some time as well. So I just want to say first and foremost that I'm so glad our dearest Katie Baxter mentioned the importance of supportive legislation because when we do experience trauma from these senseless events, legislative talks are always renewed about gun control and unfortunately don't end up anywhere. But we have a chance to get it right this time. Governor Whitmer did declare gun violence a public health crisis in her statement about the tragic and avoidable shooting in Oxford. So I'm expecting to see new bills put forth that aim to minimize the risk of injuries and deaths caused by firearms. So right now, there are 2 different packages of bills in the House and Senate to strengthen safety laws and actually financially incentivize safe storage of firearms by removing the state sales and use tax on items like lock boxes. The bills also are going to, they indicate that the owners of unsecured firearms will actually face felonies and prison time if minors are able to obtain an unsecured weapon and injure themselves or somebody else. So this is something we'll definitely be keeping an eye on if they move out of committee. The next piece I'm just going to briefly touch on is a federal push to make at-home tests more accessible and affordable. And there are a lot of positives to this, like allowing individuals to get results quickly, and not having to pay out of pocket for these tests, for these at-home tests, which actually can be really expensive and could discourage more people to not complete testing. So this is super important. Experts have advocated that, improved access to rapid testing may actually combat future surges. So this is definitely something I hope to have more details for you on soon.
Thank you so much, Mary Catherine, for that update. And certainly we'll look forward to continue to learn more about what's going on. Just to quickly, Dr. Deborah just shared with us some insights, and there was a shout out to Dr. Deborah. One of our participants heard you and her family heard you on NPR, and they just want to give you a shout out and said her family heard you, and they said, oh my, that is a smart lady. And so we're happy to have credible folks right here in our community that's talking all across this nation about important information. So thank you, Dr. Deborah, and thank you to our participant who shared that. Kiana, what's happening in the city?
If I could just find the unmute button. Good afternoon, everybody. I hope you all are well. I just have a few updates from the city of Flint, beginning with the vaccination clinics. We are really excited to host next week at the mini stations, vaccination clinics. That's the north end, the north side mini station, as well as the South Flint mini station on December 14th, December 16th, and December 17th, 2 o'clock until 7 o'clock in the afternoon. So that information is available, all the details available on social media as well as on the city's website, and by giving us a call at 810-410-2020. So we look forward to the community turning out for the vaccination clinics next week at the mini stations. Just a few more things. One is just a community reminder of how to report malfunctioning, come on words, or damaged traffic signals. You can reach out to the City of Flint's Traffic Engineering Division. Their contact number is 810-766-7135. If anybody is in immediate danger, though, please remember to call 911. But that, if anyone in the community sees any damaged or malfunctioning traffic lights, please reach out to the City of Flint Traffic Engineering Division and they'll get that wrapped up. Just one last thing. We have 20 positions open here at the City of Flint. And I want to encourage everyone who might be interested in working with the City of Flint to take a look at the city's website at cityoflint.com/jobs and apply for those open positions.
Thank you, Kiana. Just one more time. Give us that number if there's something wrong with the traffic signal.
If there's an emergency, call 911, but otherwise the number is 810-766-7135.
Thank you so much, Kiana, and thank all of you that participated in our webinar today. Dr. Deborah, I saw you. I just want to give you one more time. If you want to just say something, that great shout out that was given to you and all of our participants. There's so many times during the week I hear wonderful things about what people are able to say and do as a result of your involvement. So again, thank you so much.
Yeah, and thanks. These are tough times, and we got to make some real tough calls. So, I appreciate the opportunity. I feel like I got my mojo in this webinar because people have really inspired me to keep my science hat on, but also to be bold and courageous and speak the truth as I know it, and also bring the data forward. So, I salute the folks on this webinar. I get myself, I am because we are. So just thank you all. Thank you.
Thank you, Dr. Deborah. And that is result of that and all of our participants on the panel. We're able to continue to provide continuing education units for our community health workers. Social workers can get contact hours even for the webinar today. So we thank you for joining us. We want to continue to ask you to like us on Facebook. Join us and subscribe to our YouTube channel Email us any questions that you might have at info@hfrcc.org. And remember, we are planning to be here next week. We already have a great lineup for you. So we want you to join us. Continue to put your questions in the queue. Continue to reach out to us, and we'll do our best to make sure we get credible information right to you. Again, thank you for connecting. Join us next week, and we will look forward to our conversation.